Recording in progress.
Hello, my name is Paula Pensin Carraro. I'm going to present HIV/AIDS epidemic in Japan. Well, to start, I'm going to talk about the background of Japan. Japan is an island located in East Asia, consisting of four main islands. Its population is around 124 million people. Japan is a highly developed country with universal health care and one of the lowest HIV prevalence rates among developed nations. And it has high life expectancy, advanced healthcare infrastructure, and politically stable with high human development index. Background of HIV/AIDS outbreak. The timeline of the epidemic starts in 1980s when the first HIV/AIDS cases were identified in Japan. In 1984, the national surveillance system was established. In late 1980s, early 1990s, a major public concern over HIV infections linked to contaminated blood products used by hemophilia patients. In 1989, AIDS prevention law was enacted. In 1999, HIV surveillance incorporated into infectious disease control law. Methods of surveillance used in Japan. So, Japan utilizes a case-based reporting, laboratory-based surveillance, sentinel behavioral surveillance, and voluntary counseling and testing. So, for case-based reporting, it's a mandatory nationwide reporting by physicians, collection of demographic information, route of transmission, nationality, age, and sex, and it is used in both urban and rural settings. For the laboratory-based surveillance, HIV testing data collected from hospitals and public health centers and private clinics. Laboratory confirmation supports case reporting and monitoring of trends. The sentinel and behavioral surveillance, monitoring of high risk populations, including men who have sex with men and other vulnerable groups, and studies assess behavioral risk factors for concentrated epidemic. For the voluntary counseling and testing, free anonymous HIV testing is available, most utilized in major cities such as Tokyo, Osaka, and Fukuoka. Late diagnosis remains a significant challenge. Epidemiology of HIV/AIDS in Japan. HIV remains a concentrated epidemic, not a generalized one. Most new infections occur through sexual transmission, particularly among men who have sex with men. So, in 2023, 54,171 people live with AIDS in Japan. This is the accumulated number. 2,986 new infections per year and 192 deaths from AIDS per year. This data excludes infections linked to contaminated blood products. HIV burden in Japan. One of the lowest HIV prevalence rates among developed countries, HIV epidemic remains concentrated rather than generalized. A comparison with other Asian countries. So neighboring countries are Taiwan, South Korea, and China. And Compared with this country, Japan has substantially lower HIV prevalence. Um, however, continues to face challenges related to late diagnosis and reaching key populations at risk. The demographics of HIV/AIDS in Japan, so approximately 85% to 90% of reported HIV cases occur among males. Female cases represent a relatively small proportion of total infections. Most infections occur among adults aged 20 to 49 years. The highest incidence is generally reported among individuals in their 20s and 30s. And most reported cases occur among Japanese nationals, although cases among foreign residents are also reported. HIV cases are concentrated in large metropolitan areas, and other major cities where high risk populations are more concentrated. So the predominant risk factors in the primary mode of HIV transmission in Japan is sexual contact. And the major risk factors include men who have sex with men, the largest affected population, unprotected sexual intercourse, multiple sexual partners, limited uptake of HIV testing, late diagnosis and delayed treatment initiation, persistent stigma that disencourages testing and disclosure. Implemented preventive measures. Historical measures, AIDS prevention law, public education campaigns during 1980s and 1990s, improved blood screening procedures following contaminated blood product incidents. Current measures, free and anonymous HIV testing at public health centers, nationwide HIV surveillance, condom promotion campaigns, access to RV through the healthcare system, public awareness and education programs, and expanded HIV testing in clinics and healthcare facilities. Barriers faced by Japan in HIV/AIDS control. The major challenges are the absence of formally approved and nationally accessible PrEP in Japan poses a significant barrier to reducing HIV incidence among men who have sex with men, who bear disproportionate burden of new infections. Stigma and discrimination, late diagnosis, limited awareness, insufficient PrEP utilization, and reaching high-risk populations. Um, Japan has successfully maintained a low HIV prevalence through a strong surveillance, universal health care, and art access. So it has one of the lowest HIV prevalence among the developed countries. Um, the widespread availability of antiretroviral therapy, ongoing public health education and prevention programs. But there are areas for improvement. Continue HIV transmission among men who have sex with men, high proportion of late HIV diagnosis, and limited uptake of PrEP, pre-exposure prophylaxis, and persistent stigma and discrimination affecting testing and care seeking. Proposed prevention control strategy. The goal is to reduce new HIV infections through expanded prevention, early diagnosis, and improved access to care. Components. Subsidized or insurance covered PrEP nationwide, mobile and community HIV test units in major urban centers, social media campaigns promoting HIV testing and PrEP awareness, partnership with LGBTQ plus organizations and community groups, and rapid linkage to HIV care for newly diagnosed individuals. Expected outcomes: reduce HIV incidence, earlier diagnosis, increased awareness of HIV prevention, reduce the stigma, improved achievement of international HIV control targets. Those are the references. Thank you very much for listening.